has been leveraged to improve prevention and treatment options across the HIV care continuum. Progress has been remarkable, but regrettably highly unequal. Unequal progress in reducing new HIV infections, limited access to treatment, and unending AIDS-related deaths, with too many vulnerable people and populations left behind. These remain a concern. Additionally, stigma and discrimination, together with other social inequalities and exclusion, are proving to be key barriers. The progress made is fragile and at risk of being reversed if we do not renew our commitment and accelerate action. Mr. President, in our part of the world, young women and adolescent girls remain vulnerable and are disproportionately affected by HIV pandemic. We need to scale up efforts to address the structural factors that increases vulnerability of our various population groups to new HIV infections. We also need to invest in interventions for communities to be able to prevent new infections among young women and those that address gender inequality. Further, the AIDS pandemic not only affects the health of individuals, it also impacts households, communities, and the development and economic growth of nations. I'm therefore pleased to note that in March 2021, the African Union and UNAIDS recommitted to a partnership that seeks to eliminate AIDS as a danger to public health in the next decade. At the national level, Namibia has made significant progress. As a country, we have managed to reduce our adult HIV incidence rate and achieved viral load suppression in more than 73% of people living with HIV. These steps have been achieved as a result of scaled-up domestic investment in the HIV response, strategic expansion of HIV prevention and treatment services, with a focus on viral load suppression at individual and community levels, and the swift implementation of forward-leading HIV policies. These strategies, coupled with strong country ownership of policies and strong partnership with various development partners such as the UN Family, PEPFAR, and others in the field, have enabled the government to actually map out what needs to be done and to target those areas with the highest prevalence rates. Mr. President, the COVID-19 pandemic has exposed the need for more investment in public health. It has reinforced that epidemics expose and aggravate existing inequalities and impact most negatively on those who are already marginalized. The COVID-19 crisis has also amplified the importance of global solidarity, showing us that no one is safe until all of us are safe. Mr. President, I am proud of the role that Namibia played as chair of the UN AIDS Program Coordinating Board in the adoption of a bold global AIDS strategy. In conclusion, I urge all countries to scale up evidence-based HIV/AIDS prevention efforts and address underlying structural barriers to get us back on track on ending the AIDS epidemic by 2030, enhancing global solidarity to close the HIV response resources gap, and continuously monitoring our progress towards our targets so as to steer our response in the right direction. I thank you.
Deseo agradecer al vicepresidente de la República de Namibia por su intervención. Doy ahora la palabra al distinguido representante de Sudán del Sur para que presente el discurso del vicepresidente.
Mr. President, thank you for the opportunity to introduce the pre-recorded statement by His Excellency Dr. James Wani Iga, the Vice President of the Republic of South Sudan, at the 2021 UN High-Level Meeting on HIV and AIDS. I thank you, sir.
Your Excellency, the President of the General Assembly of UN, Your Excellencies, heads of state and government, distinguished guests, ladies and gentlemen, I am honored to present this statement on behalf of my President, the President of the Republic of South Sudan, His Excellency Salva Kiir Mayardit, in this official opening of this high-level meeting of HIV and AIDS. This high-level meeting is historic and remarkable. It is 40 years since the first cases of HIV were reported, and 20 years since the world community, for the first time, collectively set ambitious targets to halt and reverse the spread of HIV by 2015. As a globe, we have since then set ourselves ambitious goals, including to end AIDS as a public health threat by 2020. These ambitious goals, along with global solidarity, have inspired us to making significant progress in the global AIDS response. We have, among other things, found treatment, tripled the number of people on treatment since 2010, and almost halved AIDS-related deaths during the same period. Some countries have even achieved epidemic control, demonstrating that we have the knowledge and the technology to achieve our goals. In South Sudan, we have made progress in treatment and prevention of mother-to-child transmission of HIV and recorded some reduction in AIDS-related deaths. Your Excellencies, despite these achievements, the global AIDS response is yet to meet the targets we set in the political declaration in 2016. That means we need to do far more and more quickly to achieve the goal of ending AIDS as a public health threat by 2030. In countries like South Sudan, with frequent humanitarian emergencies, including protracted complex food security, climate change, such as flooding, and we also have the curse of desert locusts, and so on. These are on increase. This leads to depleted health services, isolated communities, and increased vulnerabilities, particularly among refugees and internally displaced people and other populations. Consequently, we have fragile health systems with serious impacts on HIV service delivery. Without adequate support and investment, we cannot meet the goal of ending AIDS as a public menace by 2030. In addition, we need to ensure equal access to HIV services for all peoples without exception. This means deliberately identifying communities and groups that have been left behind and facilitating their access to HIV services. In today's world, we cannot talk about HIV/AIDS without recognizing the threat of this pandemic, the new pandemic called COVID-19. COVID-19 has exposed the fragility of progress made in health and development and reversed economic progress in many countries. It has fragmented the global solidarity and shifted the focus and resources from HIV. However, we cannot afford a reversal of gains we have made in the global AIDS response so far. This is the time to recommit to the goal of ending AIDS as a public threat by 2030. In conclusion, ladies and gentlemen, the government of South Sudan, under the leadership of His Excellency Salva Kiir Mayardit, recommits to a smooth implementation of the revitalized peace agreement, build a resilient health system to ensure HIV services for all our people. I believe that working together as it is today, we can end AIDS as a public health threat, indeed, by 2020. We must, however, make the right decisions now. I therefore call for a strong, ambitious political declaration and renewed global solidarity at the end of this high-level meeting. I thank you all for listening to me.
Deseo agradecer al vicepresidente de la República de Sudán del Sur por su intervención. Doy ahora la palabra al distinguido representante de Tailandia para que presente el discurso de su primer ministro.
Mr. President, I have the honor to introduce the pre-recorded statement by His Excellency General Prayut Chan-o-cha, Prime Minister of the Kingdom of Thailand.
ท่านประธานและท่านผู้มีเกียรติทุกท่านครับผมขอขอบคุณคณะผู้แทนถาวรออสเตรเลียและนามิเบียที่ได้สนับสนุนการจัดประชุมในครั้งนี้ซึ่งเป็นโอกาสให้พวกเราทุกคนได้มาร่วมกันติดตามความก้าวหน้าของการดำเนินการตามปฏิญญาทางการเมืองเรื่อง HIV และ AIDS ในปี 2559 และร่วมรับรองปฏิญญาฉบับใหม่เพื่อนำไปสู่การบรรลุเป้าหมายการพัฒนาที่ยั่งยืนในการยุติปัญหาการแพร่ระบาดของโรคเอดส์ภายในปี 2573 ในปัจจุบันภายใต้ความผันผวนของสถานการณ์โลกโดยเฉพาะอย่างยิ่งการแพร่ระบาดของโควิด -19 ซึ่งนอกจากจะส่งผลกระทบอย่างรุนแรงต่อชีวิตและความเป็นอยู่ของประชาชนทั่วโลกในภาพรวมแล้วยังก่อให้เกิดความชะงักกันในกระบวนการแก้ไขปัญหาโรคเอดส์ด้วยโดยผู้ที่ติดเชื้อดังกล่าวได้กลายเป็นกลุ่มคนที่มีความเปราะบางยิ่งขึ้นจนนำไปสู่การเกิดปัญหาความเหลื่อมล้ำในสังคมที่มากไปกว่าเดิมดังนั้นการประชุมในครั้งนี้จึงถือเป็นโอกาสสำคัญที่เราจะได้กลับมาสานต่อความร่วมมือที่ผ่านมาและแสวงหาแนวทางใหม่ๆเพื่อรับมือกับความท้าทายของโลกนี้ต่อไปท่านประธานครับภายใต้บริบทของทศวรรษแห่งการดำเนินการอย่างจริงจังเพื่อบรรลุเป้าหมายการพัฒนาที่ยั่งยืนประเทศไทยมุ่งมั่นที่จะเร่งรัดการดำเนินการต่างๆทั้งภายในประเทศและระหว่างประเทศในเรื่องโรคเอดส์ให้ประสบผลสำเร็จยิ่งขึ้นไปอีกโดยผมขอเสนอมุมมองของไทยดังนี้ประการแรกเราต้องเร่งรัดการพัฒนาด้านนวัตกรรมและการขยายความครอบคลุมซึ่งหมายถึงการให้บริการตรวจวินิจฉัยหาเชื้อ HIV ด้วยนวัตกรรมใหม่ๆและการจัดสรรชุดบริการป้องกันแบบผสมผสานที่ครอบคลุมและเป็นมิตรให้แก่ทุกคนที่มีความต้องการ โดยเฉพาะอย่างยิ่งกลุ่มเยาวชนและกลุ่มเป้าหมายหลักต่างๆทั้งนี้ระบบหลักประกันสุขภาพทั่วหน้ามีส่วนสำคัญอย่างมากต่อการบรรลุแนวทางดังกล่าวผ่านการให้บริการที่ครอบคลุมเช่นบริการเพล็บบริการตรวจวินิจฉัยและโรคติดต่อทางเพศสัมพันธ์และการบริหารจัดการกลุ่มที่มีความเสี่ยงจากการใช้สารเสพติดเป็นต้นโดยสรุปแล้วการที่เราสามารถตรวจหาการติดเชื้อ HIV ได้เร็วจะทำให้ประชาชนได้รับการดูแลรักษาและป้องกันการติดเชื้อได้อย่างมีประสิทธิภาพยิ่งขึ้นประการที่2เราต้องมีเจตจำนงทางการเมืองที่แน่วแน่โดยส่งเสริมการมีส่วนของภาครัฐและทุกภาคส่วนในสังคมเพื่อขจัดปัญหาความเหลื่อมล้ำการตีตราและการเลือกปฏิบัติต่อผู้ติดเชื้อ HIV ซึ่งความร่วมมือและความเข้าใจของทุกฝ่ายมีส่วนสำคัญต่อการลดอุปสรรคของการเข้าถึงบริการป้องกันตรวจวินิจฉัยและรักษาการติดเชื้อดังกล่าวประการสุดท้ายเราต้องผลักดันการมีส่วนร่วมของสังคมซึ่งถือเป็นหัวใจของการรับมือกับปัญหาโรคเอดส์อย่างมีประสิทธิภาพโดยภาคประชาสังคมตลอดจนทุกฝ่ายที่เกี่ยวข้องควรมีส่วนร่วมในการกำหนดดำเนินการและพัฒนานโยบายและการให้บริการที่เกี่ยวกับโรคดังกล่าวในทุกระดับเพื่อสอดรับและตอบสนองต่อความต้องการอย่างแท้จริงของสังคมท่านประธานครับไทยพร้อมที่จะร่วมรับรองปฏิญญาทางการเมืองเรื่อง HIV และ AIDS ในปี 2564 ซึ่งจะเป็นแนวทางในการดำเนินการเพื่อบรรลุเป้าหมายร่วมตามที่กำหนดไว้และในปีหน้าที่ไทยจะดำรงตำแหน่งประธานคณะกรรมการบริหารโครงการโรคเอดส์แห่งสหประชาชาติผมขอยืนยันว่าเราจะร่วมมือกับทุกประเทศในการส่งเสริมและสนับสนุนการดำเนินงานตามยุทธศาสตร์โรคเอดส์ปี 2564 และปฏิญญาฉบับใหม่นี้เพื่อนำไปสู่การยุติปัญหาการแพร่ระบาดของโรคเอดส์อย่างยั่งยืนภายในปี 2573 ขอบคุณครับสวัสดีครับ
Deseo agradecer al primer ministro del Reino de Tailandia por su intervención. Doy ahora la palabra al distinguido representante de Swahili para que presente el discurso del jefe de gobierno.
Mr. President, I have the honor to introduce the pre-recorded statement of the Honorable Themba Masuku, Acting Prime Minister.
Mr. President, distinguished delegates, the Kingdom of Eswatini has turned the tide against the pandemic and changed the devastating impact of HIV and AIDS into one of success and survival. 98% of people living with HIV and AIDS are enrolled on antiretroviral treatment. I want to commend the United Nations, supported by her partners, including the Global Fund, PEPFAR, the World Bank, and others, for providing strategic guidance to the HIV response and ensuring that clear and ambitious targets are set, shared, and consistently monitored. This support has also included guiding countries in strategic planning to identify priority response actions that are evidence-based and key to turning the tide against HIV. The investment case of Eswatini identified key areas for investing, including provision of art, TB, HIV, co-infection, and others. The implementation of these prioritized programs was guided by human rights and gender-based considerations and ensuring that the public health approach to service delivery is promoted to all persons without discrimination. Service delivery has ensured that we leave no one behind, and all key populations are accessing services, the target being to reduce new HIV infections in the country. The Kingdom of Eswatini has not only achieved the 95-95 95 global target, but has surpassed these targets. We have managed to halve new HIV infections. While these results are impressive, they also create a new challenge of sustaining these gains to attain the Global Vision 2030. Mr. President, the success of the Kingdom of Eswatini are rested on the firm support of bilateral and multilateral partners. The Kingdom is committed to financing the response, and we do encourage donor partners to prioritize AIDS financing in order to sustain the gains we have made. The Kingdom is pleased to be signatory to the Global Declaration, and I have no doubt that with your support, the country will reach the 2030 UN AIDS goal of ending AIDS. As I conclude, I note the rise in new epidemics, particularly the COVID-19 epidemic, which poses a threat not only to the Kingdom but the global community. I wish to express appreciation to our partners for swiftly mobilizing resources to assist countries to respond effectively and protect the gains made in HIV, TB, and malaria. I thank you, Mr. President.
Deseo agradecer al primer ministro en funciones del Reino de Eswatini por su intervención. Doy ahora la palabra al distinguido representante de Irlanda para que presente el discurso del jefe de gobierno.
Thank you, Mr. President. Mr. President, I have the honour to introduce the pre-recorded statement of the Prime Minister of Ireland on Taoiseach Micheál Martin. Thank you.
Excellencies, I am honoured to join you at this high-level meeting on HIV. Just as we need to work collaboratively in our response to COVID-19, we must also work together and deepen our response to HIV. This means continued investment in the public health infrastructures needed to eliminate HIV. And this also means ensuring that public health systems everywhere will be ready for future pandemics. Tackling the challenge of HIV is a long-standing priority for Ireland. I was Minister for Health in 2000 when Ireland established a dedicated HIV and AIDS unit within the Irish Aid Programme, and when we partnered with UNAIDS a year later. Ireland is also a founding member of the Global Fund to fight AIDS, TB and malaria. While progress has been made over these 2 decades, it is essential that we maintain and renew our focus. In 2021, Ireland will contribute to an investment of over 100 million in support to global health, including addressing HIV and AIDS. The Global AIDS Strategy 2021 to 2026 presents a bold vision. It sets a challenge to all of us as leaders. 40 years on from the first reported cases, although thankfully the number of deaths has decreased significantly, AIDS remains a grave threat to too many. Progress has not been equal. Within countries, some people are getting better care than others. Different countries can provide better supports than others. The fast-track targets for 2020 have not been met. I am optimistic, however, that we can turn the corner on this pandemic and meet the target we set for ourselves in the Sustainable Development Goals of ending AIDS as a public health threat. We will do this by actively working to reduce the inequalities that drive the pandemic. In sub-Saharan Africa, girls account for 5 in 6 of each new adolescent infection. Certain other groups and their partners continue to be disproportionately at risk. These include men who have sex with men, sex workers, transgender people, people who inject drugs, and people in prison. Collectively, these groups account for 62% of new infections globally. Behind each of these numbers is a person coming to terms with a new diagnosis. Let's recommit to making sure that fewer and fewer people have to face that moment. COVID-19 has taught us that no one is safe until everyone is safe. The same is true for HIV, and we must tackle the underlying drivers of this disease. We must put human rights and gender equality at the centre of our response. Sexual and gender-based violence and harmful gender stereotyping continue to be major drivers of the AIDS epidemic, with immediate and long-term consequences for individuals, families, communities, and societies. Violence, stigma, and discrimination have no place in our societies and must be acknowledged, confronted, and eliminated. Those at risk and people living with HIV must have access to comprehensive prevention and treatment services. We must increase funding for and access to education, particularly for comprehensive sexuality education for adolescent girls and young women in sub-Saharan Africa. Ireland is playing its part in this global effort. I am pleased to add my voice to the call on all leaders to fully implement and fund the global AIDS strategy and commit to ending inequality and ending AIDS. It is within our collective power and it is within our reach. Thank you.
Deseo agradecer al primer ministro y Taoiseach de Irlanda por su intervención. Doy ahora la palabra a la distinguida representante de Serbia para que presente el discurso de su jefa de gobierno.
Mr. President, I have a great honor to introduce the statement of Her Excellency Ana Brnabić, Prime Minister of the Republic of Serbia, on the occasion of the high-level meeting of HIV/AIDS. Thank you.
Honorable Mr. President, Excellencies, distinguished dignitaries, dear colleagues, ladies and gentlemen, I'm humbled and immensely grateful for the opportunity to deliver my speech on behalf of the Republic of Serbia. Not long ago, HIV was a huge public health threat. We remember the millions of people who lost their lives during the AIDS pandemic in the mid-1980s and early 1990s. Fortunately, science has accomplished its mission to understand and unravel the virus. And this, once lethal disease, has become manageable thanks to the discovery of ARV therapy. The HIV epidemics of the last century, unfortunately, reminds us of our present battle with another health threat, COVID pandemic. Thanks once again to the triumph of science, we are now hopeful that the outcome will be similar to our fight with AIDS, where science has given us the ability to control the virus and save lives. But we should never feel relaxed. While people continue to fall sick and lose fight against COVID, which is highly preventable and treatable, we should not stop our efforts. Efforts to date in Serbia in the field of AIDS control include, according to the latest HIV data, incidence in Serbia is 0.88 per 100,000 people. Today, we have 2,562 people who are living with HIV, and 1,852 of them are being treated with modern therapy. We have established a special government body for HIV and tuberculosis, which includes not only the representatives of relevant institutions, healthcare professionals, key opinion leaders, but also representatives of civil society in Serbia. Our accomplishments are the result of the huge efforts of all involved stakeholders. The government, which provided full access to modern ARV therapy via resources from the Health Insurance Fund, the Public Health Institute, for providing health literacy about testing and early detection, and last but certainly not the least, our NGO sector, which spread anti-stigma messages to the public. Even though we can say that in Serbia we now have HIV/AIDS under control, our work is certainly not done. Early diagnosis of HIV infection is an urgent priority. If we want to reduce the high proportion of people diagnosed with late-stage HIV infection, it is essential to diversify HIV testing strategies. The plan of the Serbian government is clear. We will improve testing, treat anyone, and break the stigma for people living with AIDS. Finally, our global solidarity and shared responsibility can help defeat the HIV pandemic. Or, for that matter, global solidarity and shared responsibility can help us all defeat COVID pandemic, while at the same time guaranteeing the right to health for all. The progress made in the last decade must be protected, and we must continue to prioritize HIV testing and treatment for all of those who need it. Thank you very much.
Deseo agradecer a la primera ministra de la República de Serbia por su intervención y doy ahora la palabra al distinguido representante de Vietnam para que presente el discurso del viceprimer ministro.
Thank you, Mr. President. Mr. President, I have the honor to introduce the pre-recorded statement of His Excellency Mr. Vũ Đức Đam, Deputy Prime Minister of the Socialist Republic of Vietnam.
Kính thưa Ngài Chủ tịch Đại hội đồng Liên Hợp Quốc, kính thưa Ngài Tổng thư ký Liên Hợp Quốc, kính thưa tất cả các quý vị đại biểu. Chúng ta đã cùng nhau trải qua gần 4 thập kỷ ứng phó với đại dịch HIV/AIDS. Và giống như nhiều quốc gia trên thế giới, Việt Nam luôn dành một sự cam kết rất cao về mặt chính trị, cũng như bằng rất nhiều giải pháp đồng bộ. Chúng ta đã cùng nhau từng bước để kiểm soát, để kiềm chế đại dịch này. 5 năm trước, chúng ta đã đặt ra mục tiêu 90-90-90. Và mặc dù chúng ta đã rất nỗ lực, nhưng trên phạm vi toàn cầu, gần như chưa một quốc gia nào đạt được mục tiêu này. Và vì thế, để tiến tới mục tiêu chấm dứt đại dịch này vào năm 2030, chúng ta đã chạy nhanh rồi, chúng ta cần phải chạy nhanh hơn nữa. Để chạy nhanh hơn, chúng ta phải làm gì? Bằng thực tiễn từ Việt Nam, chúng tôi thấy thứ nhất là chúng ta phải đảm bảo được nguồn lực, nhất là cho các nước đang phát triển. Thứ hai, chúng ta phải đảm bảo cái chuỗi cung ứng các cái thuốc để mà đối phó với virus này, cũng như là các cái sản phẩm để mọi người có thể tự xét nghiệm cho mình. Và cuối cùng, chúng ta phải nhanh chóng hơn nữa để tìm ra thuốc đặc trị để chữa khỏi căn bệnh này, cũng như là vaccine để phòng chống căn bệnh này. Từ thực tiễn của Việt Nam, việc đảm bảo tài chính bền vững là hết sức cần thiết. Chúng tôi đã tận dụng nguồn hỗ trợ của tổ chức quốc tế với ngân sách của nhà nước và với bảo hiểm y tế, và chúng tôi đã đảm bảo bền vững. Chúng tôi cũng đã xử lý rất tốt cái việc điều trị cho người bệnh, và chỉ số của chúng tôi là 96, vượt chỉ số 90. Nhưng điều quan trọng đấy là chúng ta phải làm sao cho người dân tự phát hiện ra virus sớm hơn, và khi phát hiện rồi thì được điều trị ngay. Và một bài toán rất quan trọng làm cho người dân thấy là việc phát hiện sớm và tiếp cận với cơ sở y tế để được điều trị sớm là một việc làm hết sức bình thường. Và điều bình thường này chính là điều chúng ta phải nỗ lực nhiều nhất. Tôi tin tưởng rằng với sự nỗ lực của cộng đồng quốc tế, chúng ta có niềm tin là chúng ta sẽ chiến thắng đại dịch vào năm 2030. Và vì thế tôi xin nhắc lại cái lời cam kết của Việt Nam cũng như kêu gọi cộng đồng quốc tế là mục tiêu 90-90-90, hay bây giờ chúng ta đặt ra là 95-95-95, thì hãy nỗ lực bằng 100-100-100 và hơn thế nữa.
Deseo agradecer al viceprimer ministro de Vietnam por su intervención. Doy ahora la palabra a la distinguida representante de la Unión Europea para que presente la declaración de la ministra.
Mr. President, Excellencies and colleagues, I have the honor to introduce the pre-recorded statement and message of the European Union's Commissioner, Mrs. Jutta Urpilainen, the Commissioner for International Partnerships.
For over a year, we have fought a battle against the COVID-19 pandemic. But we must not forget the other enduring global battle against HIV and AIDS epidemic. COVID has caused disruptions to essential health services, including on HIV and AIDS. This is why EU so much welcomes today's high-level meeting, as well as the new global AIDS strategy. We need to address inequalities, the reason vulnerable and marginalized populations are most affected by HIV and AIDS. We need to focus on gender equality, especially young women and girls continue to be affected by HIV and AIDS. We need to put people and community-led initiatives first, taking the first step to ending stigma and discrimination. The European Commission is a strong supporter of the Global Fund. Since its creation, we have committed a total of 2.6 billion euros. In addition, we support health system strengthening and universal health coverage in line with the Rome Declaration adopted at the Global Health Summit. We also prepare a Team Europe initiative on manufacturing and access to vaccines, medicines, and health technologies with our African partners. Because together we will end the epidemic of HIV and AIDS by 2030.
Deseo agradecer a la comisaria europea de Asociaciones Internacionales de la Unión Europea por su intervención. Doy ahora la palabra al distinguido representante de Indonesia para que presente la declaración del ministro.
Mr. President, I have the honor to introduce the pre-recorded statement by His Excellency Mr. Budi Gunadi Sadikin, the Minister of Health of the Republic of Indonesia and the current chair of ASEAN Health Ministers Meeting. Thank you.
Excellency, the President of the United Nations General Assembly, it is my great honor to deliver a statement to the United Nations High-Level Meeting on HIV and AIDS on behalf of ASEAN Health Sector. Mr. President, Excellencies, ASEAN reaffirms our long-standing commitment to curbing the rate of new HIV infections and AIDS-related death. This was reiterated through the 2015 Asian Declarations to end the AIDS epidemic by 2030, through reducing new HIV infections and AIDS-related death, and eliminating HIV-related stigma and discriminations. After 5 years, progress towards ending AIDS in ASEAN has been uneven. 4 countries have been making significant progress in reaching AIDS epidemic control, and 6 others seeing increases in new infections among youth people and people living with or at risk of and affected by HIV. This situation has resulted in growing burdens of illness and death, which exacerbated the existing inequalities and further contributing to the negative socio-economic impacts. ASEAN is aware that inequalities in our societies have contributed to the uneven progress in achieving global 2020 HIV targets in our region. For this reason, we welcome the new Global AIDS Strategy 2021-2026 to end inequalities and end AIDS. The strategy provides ASEAN member states with the guidance to re-energize national strategies according to national legislation, priorities, and evidence about the epidemic in each member state and in line with new global targets and minimum standards. Mr. President, Excellencies, we recognize that getting back on track towards ending AIDS by 2030 in ASEAN requires commitment to maximizing equitable and equal access to HIV services and solutions. This means infusing new energy, accepting innovations, addressing co-infections such as tuberculosis and multi-drug resistant tuberculosis, strengthening people-centered services and community-delivered HIV services such as pre-exposure prophylaxis, community-based screening and self-testing, as well as strengthening efficiency in service delivery and improving security of commodities. We further recognize that getting back on track must involve breaking down barriers, which requires better policy and legal strategies design, taking into consideration religious and socio-cultural aspects. We must also improve the resourcing to be efficient and sustainable, integrated into our health systems and social protection, as well as adaptable to humanitarian settings and pandemic responses. We, the ASEAN health sector, must maximize equal and equitable access to HIV services and solutions by ensuring that the communities most affected by HIV are involved and taking leadership roles where possible in our HIV responses, using the highest quality data and strategic information. We understand that a new global pandemic has complicated our work. The intersecting HIV and COVID-19 pandemics have contributed to slowing or reversing HIV response gains in some ASEAN member states. We must step up to the challenge of ending both as public health threats. Mr. President, Excellencies, as ASEAN Health Sector Chair, I stand before you to reaffirm our commitment through regional health response mechanism in ending AIDS by 2030. This is indeed possible with the knowledge and tools available to us. Mr. President, Excellencies, on this occasion, allow me also to highlight Indonesia's views in my capacity as Minister of Health of Indonesia. Indonesia is committed to accelerate efforts to end this forgotten pandemic by 2030 by securing HIV vaccine, therapeutics, diagnostic, and commodity. For that purpose, countries must enhance solidarity in narrowing resources gaps to control HIV and other public health threats to achieve the Sustainable Development Goals. Current development on effort to combat pandemic of COVID-19 through the proposal of waiver of certain IP rights to vaccine, therapeutics, and diagnostic is a reflection of promoting solidarity and effort to combat pandemic. I do hope that we always be open if the waiver certain IP rights be used to the effort in combating the HIV/AIDS in the future, whenever necessary, as also reflection of solidarity and common effort to solve and to end the forgotten pandemic. I thank you.
Deseo agradecer al ministro de Sanidad de Indonesia por su intervención. Doy ahora la palabra al distinguido representante de Mozambique para que presente la declaración del ministro.
President, Excellencies, distinguished delegates, I have the honor to introduce the pre-recorded statement by His Excellency Armindo Daniel Tiago, Minister of Health of the Republic of Mozambique, who will speak on behalf of His Excellency Felipe Jacinto Nyusi, President of the Republic of Mozambique. I thank you so much.
Excellencies, Head of State and Government, President of the United Nations General Assembly, Excellency, Secretary General of the United Nations, all protocol observes. I would like, on behalf of His Excellency Felipe Jacinto Nyusi, President of Mozambique, to thank the opportunity given to our country to share the state of HIV/AIDS epidemic. HIV and AIDS remains a national emergency despite of concomitant COVID-19 pandemic representing an important burden in the National Health Service. Mozambique is the second country with the highest record of new HIV infections in the SADC region. In fact, it is estimated that in 2020, 2.1 million Mozambicans were living with HIV. Of those, 130,000 were children under 15 years of age, with about 98,000 new infections and 38,000 deaths annually. It should be noted that from 2010 to 2020, the country made the following progress: 25 reduction of new infections, reduction of vertical transmission rate from 34 to 14%, 33% reduction on AIDS-related deaths. Ladies and gentlemen, HIV response has been strategically framed in the following areas. Prevention. The country uses different strategies in the context of combined HIV prevention that include behavioral, biomedical, and structural interventions focused on key and vulnerable populations, including adolescent girls and young women. Using the strategy, for example, of retaining girls in school for completion of secondary education and eliminating inequality. In the component of care and treatment, by December 2020, 95% of our health facilities were offering care and treatment, which resulted in 82% of infected people were aware of their HIV status, 68% were on retroviral treatment, and 56% had achieved viral suppression. With regard to stigma and discrimination, the government considered a vital strategy to control HIV and AIDS. In this context, efforts have been made to fill the legal gaps in order to protect the citizen and salvaguard their fundamental rights. Excellencies, the many challenges of our national response to HIV/AIDS are: 1, the need to improve combined HIV prevention; 2, increase retention and improvement of quality in services; 3, ensuring equality and empowerment of women and girls; and 4, elimination of all forms of stigma and discrimination. Excellencies, in summary, despite all challenges, our appreciation to the Mozambican response is positive regarding the implementation of the 2016 political declaration on AIDS. Our commitment is aimed to achieve global targets and implement the new political declaration by mobilizing all stakeholders and put the country back on track for the HIV epidemic by 2030. For your attention, thank you very much.
Deseo agradecer al ministro de Sanidad de Mozambique por su intervención. Doy ahora la palabra al distinguido representante de Canadá para que presente la declaración de su ministra.
Mr. President, on the occasion of the 2021 United Nations High-Level Meeting on HIV/AIDS, I have the distinct honor and pleasure to introduce the pre-recorded video of Ms. Karina Gould, the Minister of International Development of Canada.
We know that we will not be able to end the HIV epidemic until we address the intersecting inequalities, stigma, and discrimination people living with HIV experience. Canada will continue to stand up for the rights of people disproportionately affected by HIV, recognizing that high-risk individuals often belong to more than one group. We must ensure that people living with HIV, whether they are men who have sex with men, people who use drugs, sex workers, transgender people, inmates in correctional facilities, or Indigenous people, are actively involved in solutions. In Canada and around the world, we have seen people with HIV be powerful agents of change. They are the ones who have urged us to take rights-based responses that are led by communities. And they have advocated for comprehensive sexuality education and sexual and reproductive health and rights. We must heed their advice. Internationally, we need to scale up prevention initiatives. This is especially important for adolescent girls and young women because their disproportionate risk of new infections calls for urgent action. And again, they must actively be able to feed into those initiatives. We know now that government interventions have the greatest impact when we work in partnership with communities. That is how we can design solutions that are local and evidence-based, but also tailor-made to the needs of specific communities. 4 decades of HIV research and data drawn from community, government, and healthcare experience have informed many of the most successful responses during the COVID-19 pandemic. COVID-19 has shown us that it is feasible to respond quickly and globally to a health crisis. More than a year into the pandemic, there are many lessons we can draw from that response and how the international community took action. Unfortunately, COVID-19 is also reversing some of the important progress made on HIV over the past decade. Now is the time for the global community to acknowledge and confront the inequalities that underline the AIDS epidemic. We need to ask ourselves why pandemics continue to disproportionately affect those with the least power in our societies. Only through high-level political commitment and collective action will we be able to meet our SDG commitment to end the AIDS epidemic by 2030. Canada will continue to support efforts to end it and to defend comprehensive sexual and reproductive health and rights. We look forward to continuing this conversation with you when Canada hosts the International AIDS Conference next year in Montreal. Thank you.
Deseo agradecer a la ministra de Desarrollo Internacional del Canadá por su intervención. Doy ahora la palabra a la distinguida representante de España para que presente la declaración de su ministra.
Señor presidente, tengo el honor de presentar el mensaje de la ministra de Sanidad de España, doña Carolina Darias.
Presidencia de la Asamblea General, señora Vicesecretaria General, señoras, señores, ministros y ministras, saludos cordiales. Quisiera agradecer a ONU-SIDA los esfuerzos realizados para que hoy podamos celebrar esta reunión de alto nivel. La COVID-19 ha eclipsado otros problemas de salud pública y este encuentro debe servir para resituar el VIH-Sida en el centro del debate epidemiológico global, porque nos enfrentamos a una paradoja. En apenas un año hemos desarrollado varias vacunas contra la COVID-19 y estamos logrando arrinconar el virus, pero el VIH-Sida, casi 4 décadas después, sigue matando a cientos de miles de personas cada año y sigue siendo un motivo de estigma y de discriminación. Es verdad que España ha dado pasos de gigante en la respuesta al VIH. La recuperación de la sanidad universal en nuestro país en el año 18 ha mejorado la cobertura y la financiación de los tratamientos antirretrovirales, así como la profilaxis post-exposición y la profilaxis pre-exposición. Y es que apostamos por combinar dichas herramientas con el uso del preservativo y también con la realización de test para prevenir nuevas infecciones. Nuestro objetivo es firme: 95% de las personas con VIH diagnosticadas, 95% de ellas en tratamiento y 95% de ellas con carga viral indetectable y, por tanto, intransmisible. junto al 0% de discriminación, ese es el rumbo que nos hemos marcado en nuestro Plan Estratégico de Prevención y Control de la Infección por VIH y otras ITS 2021-2030. Algunos ejemplos. Hemos desplegado medidas históricas a través del Pacto Social por la No Discriminación y la Igualdad de Trato asociada al VIH. Así, hemos prohibido la exclusión de personas mayores que viven con VIH en las residencias públicas o privadas con plazas concertadas. Y además, hemos eliminado el criterio que excluía a las personas infectadas de la posibilidad de acceder a la función pública, sirviendo el VIH como catalizador de las reivindicaciones de otros colectivos, como las personas con diabetes, enfermedad celíaca o psoriasis. España está alineada con los Objetivos de Desarrollo Sostenible. Queremos poner fin a esta epidemia en 2030. Un reto que exige muchas cosas, pero especialmente un reto que exige un alto nivel de compromiso multilateral para salvar las distancias entre el norte global y el sur global, como está haciendo España, por ejemplo, con proyectos de cooperación con América. Finalizo con un mensaje claro. Está en nuestras manos erradicar la transmisión del VIH y mejorar la vida de las personas que viven con él. Es una cuestión de voluntad política. Hagamos lo posible. Muchas gracias.
Deseo agradecer a la ministra de Sanidad de España por su intervención. Doy ahora la palabra al distinguido representante de Dinamarca para que presente la declaración de su ministro.
Thank you, Mr. President. Last year, 1.5 million people became newly infected with HIV, of which a large part was young people. Young women aged 15 to 24 years are twice as likely to be living with HIV than their male counterparts. Nonetheless, youth, especially adolescent and young women, are too often overlooked and overheard in the fight against HIV/AIDS. Therefore, it is my pleasure not only to introduce the Danish Minister for Development Cooperation, His Excellency Mr. Flemming Møller Mortensen, but also the Danish Global Youth Advisor, Ms. Natasha Skalgaard.
Good morning, good afternoon, good evening, colleagues. I'm delighted to speak on behalf of Denmark. AIDS continues to devastate regions, communities, and lives across the world. Every year, 700,000 people die from AIDS-related illnesses, and AIDS remains among the leading causes of death for women of reproductive age in sub-Saharan Africa. 5 years after the last high-level meeting on HIV and AIDS, none of our goals for preventing the spread of AIDS have been met. This is deeply regrettable. We will not win the fight against HIV/AIDS without a strong commitment to human rights and gender equality. Firstly, we must ensure that sexual and reproductive health and rights for everyone is achieved, including access to affordable and high-quality HIV services. Secondly, it is vital that young people are empowered to protect themselves from HIV through comprehensive sexuality education. Finally, while no one is safe from HIV, evidence shows that some are more vulnerable to HIV than others are. Key populations, including young people, LGBTI persons, men who have sex with men, sex workers, persons who use drugs, and prisoners have a higher risk of HIV than the general population. We need to listen to their voices and include them at all levels.
My name is Natasha, and I'm the Global Youth Advisor in the Danish Ministry of Foreign Affairs. And I'm very grateful that my minister is sharing his speaking time with me today. I'm fortunate enough to have grown up in a country where comprehensive sexuality education and reproductive and sexual health services are available to young people. Unfortunately, that is not the case for the majority of young people today. Despite progress in treatment and knowledge about prevention, HIV/AIDS continues to undermine communities and lives of young people. Adolescents and young women between the age of 15 to 25 are especially vulnerable to HIV infections, and they often lack the power, the knowledge, and the means to protect themselves. Stigma, discrimination, and human rights violations continue to lead to increased vulnerability to HIV, and those most at risk are often left behind. So today we call for action and for commitment. We need to promote gender equality and the rights of women and girls. We must ensure that all young people are empowered, actively engaged, and have access to comprehensive sexuality education. And we must ensure that all people's needs for sexual and reproductive health services are met, regardless of gender, sexual orientation, or social status. And we must ensure that people living with HIV are empowered to take a leading role in the fight against AIDS. We urgently need to act to ensure ending AIDS becomes a reality now. Thank you.
Deseo agradecer al ministro de Cooperación para el Desarrollo y ministro de Cooperación Nórdica de Dinamarca por su intervención. Doy ahora la palabra al distinguido representante de Suiza para que presente la declaración del ministro.
Monsieur le Président, j'ai l'honneur d'introduire la déclaration vidéo préenregistrée par son Excellence Monsieur Ignacio Cassis, conseiller fédéral et chef du département fédéral des affaires étrangères de la Suisse. Je vous remercie.
Monsieur le Président de l'Assemblée générale, Excellences, Mesdames et Messieurs, lorsque j'étais médecin responsable de la santé publique de l'un des 26 États cantonaux de la Suisse, j'ai pu observer le début de l'épidémie de VIH-Sida dans notre pays. C'était il y a bientôt 40 ans. La souffrance physique et mentale, ainsi que la stigmatisation sociale des personnes infectées par le VIH était une réalité quotidienne. À l'époque, nous étions confrontés à une nouvelle épidémie, tout comme nous le sommes aujourd'hui avec la Covid-19, même si les deux maladies sont bien différentes. De nombreux phénomènes observés à cette époque sont d'une actualité brûlante dans le contexte de la Covid-19. La peur, le bouleversement social, la perte des libertés individuelles. Mais également, sur une note plus positive, la solidarité et le rôle de la recherche scientifique, les investissements collectifs. Depuis, des progrès remarquables ont été réalisés dans la lutte contre le VIH-Sida. Ceci est en grande partie dû à la coopération de nous tous, à la coopération internationale. Les partenariats entre gouvernements, secteur privé, sciences, société civile ont été gagnants. Mesdames et messieurs, le sida est toujours présent, surtout dans les pays les plus fragiles. Nous ne devons pas relâcher nos efforts. Il est de notre responsabilité collective de fournir les ressources nécessaires pour maîtriser non seulement la pandémie de Covid-19, mais aussi les autres fléaux, que ce soit la tuberculose, le paludisme, les maladies tropicales négligées et surtout, justement, le VIH-Sida. Des millions de personnes, nos sociétés, notre économie en dépendent. Pour mettre fin à la pandémie, il est essentiel de nous focaliser sur ceux qui en ont le plus besoin. Il s'agit des personnes vulnérables, en particulier les jeunes femmes et les filles en Afrique. Ces personnes doivent avoir accès aux mesures de prévention, aux soins et à l'information. Malheureusement, il n'existe pas de vaccin contre le VIH. Donc, nos efforts doivent être poursuivis, encore et encore, génération après génération, sans relâche. Mesdames et messieurs, la Suisse soutient résolument la nouvelle stratégie mondiale contre le VIH-Sida, l'ONU-Sida et ses partenaires. Il est crucial de renforcer le travail de prévention générale et ciblée. Il est fondamental de renforcer la recherche médicale. Je suis confiant qu'ensemble, nous y parviendrons. Je vous remercie.
Deseo agradecer al consejero federal y jefe del Departamento Federal de Relaciones Exteriores de Suiza por su intervención. Doy ahora la palabra al distinguido representante de Luxemburgo para que presente la declaración del ministro.
Merci, Monsieur le Président, Excellences, chers collègues. J'ai l'honneur de présenter l'intervention préenregistrée de Monsieur Franz Fayo, ministre de la Coopération et de l'Action humanitaire et ministre de l'économie du gouvernement du Grand-Duché de Luxembourg.
Although only virtually, it is my great pleasure to address you at this important high-level meeting on HIV/AIDS. 40 years ago, the first cases of HIV/AIDS were reported. 20 years later, the United Nations General Assembly convened its first session to address a pandemic that was causing death on a tremendous scale. The acquired expertise over the past 40 years of the global AIDS response has been critical in guiding the current response to the COVID-19 pandemic. Progress made towards achieving the 2030 agenda is highly uneven, and even the global goals adopted in the 2016 political declaration on ending AIDS have not been met. COVID-19 has disrupted the important strides we made against HIV/AIDS and has set us back from achieving our target of ending it. We need to get back on track. As Minister for Development Cooperation and Humanitarian Affairs, I believe that ending inequalities is the most important goal we need to achieve. The lack of attention to the needs of vulnerable populations, marginalized and criminalized for their gender identity and sexual orientation, must be addressed. In our fight, no one can be left behind. As stated by the Secretary General, inequalities are the key reason why the 2020 global targets were not met. That is why Luxembourg remains committed to strengthening the fight against HIV/AIDS by supporting key populations, in particular young girls and women, by empowering them, promoting sexual and reproductive health and rights, addressing gender-based violence, reforming punitive laws, and investing in adequate infrastructure for comprehensive HIV services. We can achieve the global targets by 2025. Ladies and gentlemen, this meeting provides us with the unique opportunity to advance the new global AIDS strategy, which rightly acknowledges that the achievement of SDG 3, good health and well-being, requires more than quality health services. It requires gender equality, access to education and to employment, community engagement, and, above all, the respect of human rights. To achieve this objective, political will and commitments at every level remain crucial. You can count on our full support to implement the global AIDS strategy and to pursue the goals set out in the political declaration. Thank you for your kind attention.
Deseo agradecer al ministro de Cooperación y Asuntos Humanitarios de Luxemburgo por su intervención. Estimados colegas, hemos escuchado la última intervención de esta sesión. Continuaremos en el debate de la reunión de alto nivel mañana por la tarde a las 16:30 en este mismo salón. También se recuerda a los miembros que la primera mesa redonda temática titulada Superar las desigualdades para acabar con el SIDA, 10 años hasta 2030, presidida por el ministro de Cooperación Internacional para el Desarrollo de Suecia, excelentísimo señor Per Olsson Frir, y moderada por la señora Reddy de Javi, integrante de United Nations Global Journalists Corps, tendrá lugar mañana a las 10 horas en este salón. Antes de levantar la sesión, ruego a las delegaciones que mantengan el distanciamiento físico al abandonar el salón. Muchas gracias por su cooperación. Se levanta la sesión.